Hi everyone, and welcome to today's video where I am going to take you with me to update my house drug box. But the first thing I want to address is, yes, I am in a car, and the reason for that is I simply cannot find a moment to film this video because I've got a now 7-month-old and it's really hard to find a moment. So today my husband is looking after her whilst I have driven to our nearest retail park and I'm just filming this video. Okay, so let's get through this. I feel like every pharmacist has a drug box, and not even just pharmacists, people in general who might be on medications, who have comorbidities, or even just people in general, they have like a drug box. I have had a old drug box that my mum gave me years ago, and basically it's been overflowing for months. So I wanted to take this opportunity to organise it all again, make sure it's all ready and tidy for the baby and for us in the future and for travel. And so that is what I've done today. So the first thing that I did was go through the medications that I want to get rid of to create some space. And the first medication on that list was limecycline. So limecycline is a tetracycline antibiotic, and it works by basically inhibiting the protein synthesis and therefore killing the bacteria that way. And I guess it was supposed to kill the bacteria on my skin and clear up my acne. So I had it prescribed for acne. They say on the NHS website to use it for about 8 weeks to see any progress. I used limecycline for about 3 to 4 months. It did nothing for my acne. And I have been on a bit of a journey in terms of my acne. It all kind of started during COVID time when I was having the masks on in hospital and I was breathing, and all of the just sweat and dust and bacteria and everything was just building up. Basically had acne all across the cheeks ever since 2020. But anyway, as I say, the limecycline didn't work for me, so that is the first drug that I would like to get rid of. And speaking about skincare, I did want to talk about what I'm using currently. So at the moment, I've teamed up with Skin&Me. So I've been using Skin&Me for just under a year, I would say. I used them all throughout my pregnancy, and I was just breaking out constantly, so I kind of wanted to get some personalized skincare. So how Skin&Me works is that you take pictures of your skin, you send them in, they will give you a daily doser. So the daily doser looks like this. And what I really love about Skin&Me is just how simple it is, because I have gone through the whole 10-step skincare as a Korean, and I don't think that was doing anything for my skin. It was literally just causing me to break out because I was having so many products on it. And the daily dose is just literally, that's it. You put that on, that is your skincare. You cleanse, put this on, moisturize. That's what I do at night. It's just so simple. I take it on holiday with me. I found them to be such a good company, hence why I asked to team up with them, and I'm now a brand ambassador for them. So if you use my link and the code down below in the description box, then you can get your first daily doser for £3.50. As you guys know, I would not promote a company or even talk about a company that I myself personally haven't used, and I feel like having used them for over 9 months, it's working for me. My daily doser has changed slightly since I've stopped breastfeeding and I'm no longer pregnant, but they will create your daily doser according to your skin needs. So yeah, make sure to use my link and the code below and you'll get your first daily doser for £3.50. So the next medication that I'm getting rid of is fexofenadine. Now fexofenadine is a non-drowsy antihistamine. The trainee pharmacist will know that there are non-drowsy and drowsy antihistamines. Fexofenadine falls into the category of non-drowsy, and my husband was prescribed this just for his hay fever in the summer when it gets really severe. And fun fact about fexofenadine actually, you should avoid taking it with apple, orange or grapefruit juice because that can decrease the absorption of the drug, making it less effective. So yeah, that's fexofenadine. The next medication that I'm getting rid of is trimethoprim. So trimethoprim is a dihydrofolate reductase inhibitor, which is an enzyme that's needed by bacteria for bacterial folic acid synthesis. And I was prescribed this for a UTI. It's expired now. I'm just getting rid of it. Trainee pharmacist, you guys need to know about this medication because it's guaranteed to come up in your exam, whether it's about a interaction with methotrexate or whether it's about prescribing in a UTI situation. No trimethoprim inside out. Okay, so the next medications that I'm going to talk about are drugs that I actually have and I'm going to keep. So the first one is ferrous fumarate and ferrous sulfate. So I was prescribed these during my maternity, like pregnancy, and the reason for that is because I had iron deficiency anemia in pregnancy. As far as I'm aware, the reason why this can happen is because the volume of blood in your body increases and so does your body's need for iron. Obviously when you are pregnant, that iron is going to your baby, well, the oxygen is going to your baby, hence why women who are pregnant can get iron deficiency anemia, and so that is why I was prescribed these. I had severe constipation actually on ferrous sulfate, so I asked to change it to ferrous fumarate, and turned out this was better for me. Again, it depends on your body, it depends on, you know, what works for you, but that's what happened with me. It is true what they say, taking iron supplements can literally lead to darkened stools, and I don't know why I'm talking about stools and giving you the information, it's TMI, but it definitely can darken your stools. The next medication that I've got is actually sodium doxysate. So this is a stool softener, and the reason why I've got this is because after a C-section, I needed this stool softener. I was so scared to go to the toilet and have a bowel movement because it kind of felt like all of my insides had been in like a washing machine and my scar was going to reopen if I like pushed too hard. I did ask for laxatives in my discharge letter, and unfortunately the doctors forgot it. I don't know if you guys have seen my labour video. Yeah, let's not go there. So they forgot to prescribe me a laxative, so I ended up just buying these doxysate capsules, and I didn't use too many, but I've just kept them because I can use them if I need them at some other time. The next medication that I've got are these vitamins. So these vitamins contain vitamin C, D and folic acid, and vitamin C and D are in general good for fertility, and folic acid is needed for women who are trying to get pregnant or are pregnant because it can prevent neural tube defects in the baby. First, when I was told this, I was like, what does that mean? What's neural tube defects? And basically it's any problems with the baby's brain or spine. So I got these for free, and I was using Pregnacare at the time, so that's why there's still some left in here, but I'm just keeping these in case I need them for future use. The next medication that I'm keeping is the favourite, paracetamol. So these are just your classic analgesic and also antipyretic, meaning that it can help in fever. How paracetamol works is basically they block the chemical messengers in the brain that tell your body that you're in pain. So yeah, everyone has paracetamol probably in the household, and they're a good favourite of mine. You can buy up to 16 in any kind of shop and up to 32 in a pharmacy. For trainee pharmacists, what I would say is just brush up on paracetamol overdose, such as what you would treat that with. The next medication that I've got is dihydrocodeine, which is also a painkiller, and this medication is classified as an opioid, and this basically works by blocking pain signals from the central nervous system in the brain. So I was prescribed these after a C-section, and I really didn't want to go on them. I thought I'd be able to manage with just paracetamol, but I was in a lot of pain and couldn't really move, couldn't cough, couldn't laugh, couldn't sit up. So that is why I was on dihydrocodeine, and the reason why this is given to breastfeeding mothers instead of codeine is because codeine is converted to morphine by the liver enzyme CYP2D6. Now there's a lot of genetic variations of this enzyme in different people, meaning that some people metabolize it into morphine and there's significantly larger amounts of morphine in the plasma, and other people not so much. However, if you're breastfeeding, we don't know to what levels that you're going to metabolize codeine into morphine, hence why it can be dangerous to the baby. So we give dihydrocodeine instead of codeine. The next medication I've got is ibuprofen. I should probably mention why some of the medications are in boxes and some are just like this, but as a pharmacist I find that I can have more space if I just remove the boxes because I already know the doses. But obviously if you don't know your doses, then it's probably important to keep your boxes as well. But yes, I cut mine if I can, if I've used them, and it just creates more space for me in terms of my drug box. But remember to never cut the expiry off, so mine still has expiry here. Anyway, I digress. The next medication that I've got is ibuprofen, and this is just simply for any inflammatory pain that I have, such as period pain, toothache, and that's about it really. The next medications that I've got are two antihistamines. So one is chlorphenamine and the other one is cetirizine. So chlorphenamine is known to be on the list of drowsy antihistamines, and cetirizine is known to be on the non-drowsy list of antihistamines. And so with these we actually just bought these for, like I said, my husband gets quite bad hay fever during the summer seasons, and that is why. So the next one is an interesting one. It's actually not my medication. It's melatonin, and you need a prescription for this in the UK, and it's indicated for insomnia and jet lag. However, in America, you can just buy these over the counter, and my friend from America left these by accident, and so when I see her next, I'm going to give her these back, so I've kept them for her. But I thought it was still useful to discuss this anyway. Melatonin is a naturally occurring hormone in the brain in our own bodies. So melatonin is produced naturally by our bodies in response to darkness, and it helps regulate our sleep cycles and wake cycles, which is why it can be helpful in insomnia. As a pharmacist, it's quite important to try and make sure that patients aren't on this long term. And another important thing to note is that you shouldn't be giving this to people with autoimmune diseases, as it's contraindicated. The next thing that I have is not necessarily a medication, but more of a supplement that I bought for myself, and that is vitamin D. So vitamin D is so critical because because it helps regulate the levels of calcium and phosphate in our bodies, which can help with bone health, mood health, it can help with thyroid, it keeps your teeth and muscles healthy, it can also help in terms of your blood sugar. So it's extremely important. And for us, our bodies can make vitamin D from the sun. I mean, it's quite sunny today in the UK, I'm not gonna lie, but usually it's very grey, hence why it's important for me to supplement myself. And it was also the case when I was breastfeeding as well, as it's important for babies just for their overall bone health and development. The next one is biotin. So I've just been taking biotin voluntarily because of my postpartum hair loss. So I got to about 3 months after the birth of my baby and I just started shedding hair to the point where I have like little sticks of hair now that have grown since my hair has actually been falling out. So what does biotin do? It improves the structure of keratin, which is a protein that makes up hair, skin and nails. I've just been trying to use biotin to help with my hair loss. I don't necessarily know if it's working, but I'm taking it consistently every day and hoping for the best. The next medication that I've got is paracetamol, and this is paracetamol syrup for the baby. So we have been recommended to have a bottle of this in the house just after her vaccines and in general in case she gets some kind of fever. And for the trainee pharmacist, I would say definitely memorize the doses of paracetamol for babies, as this can be in your calculations and it can just be a general question in your exam. So that's what's in my current box, and I've also got some leftover masks as well from the pandemic that I'm afraid of having another pandemic. So I'm just going to keep these, keep them safe, and also if I ever end up working back in hospital, they're also useful as well. So that is what I've also got in my box. What I'm going to do next is go for replenishments. So there's some things that I've wanted in the box that we have run out of or have expired and I got rid of a while ago. So firstly, I'm going to go and get rid of my medications that I've mentioned, and secondly, I'm going to replenish my drug box. Okay, so let's talk replenishments. I didn't actually buy the first replenishment, which is diarrhea sachets, and the only reason I didn't buy any was because they were only selling 20 sachets and I don't need that many. I just keep a small supply of say like 7 in the house because you never know when you're going to have any episode of diarrhea and vomiting. So when we have diarrhea or vomiting, we can lose all of the important electrolytes, and diarrhea basically replenish those electrolytes such as glucose and salts that are lost whilst we are, you know, going for it. I always like to keep a supply at home and I take them on holiday as well. The next medication that I've got is loperamide. So I also have a supply of these in the house just in case there's any sort of diarrhea episodes, and these are antidiarrheal, and how they work is they are anti-motility, meaning that they slow down the movement of food throughout the gut, leading to more water that can be drawn in so that your poos become more kind of solid rather than loose and watery. I've not actually used these before, but I always just like to keep a supply. I think I've got like severe like diarrhea and vomiting fear. Anyway, let's not go into that. The next medication that I got was esomeprazole. So my husband sometimes gets really bad reflux, and esomeprazole is a proton pump inhibitor. So proton pumps are basically enzymes that line our stomach and produce acid, which helps to digest the food. In terms of the reflux, how it works is that it inhibits those proton humps, meaning that less acid is made, and so that helps with the reflux symptoms. Fun fact, esomeprazole interacts with methotrexate and also citalopram. So when you find out what those interactions are, let me know in the comments down below. Okay, so that is it really. I have gotten rid of my expired or unwanted medications by taking them back to the pharmacy. Make sure you ask at your pharmacy whether you can actually return those. And I've also gone to the supermarket. I chose Tesco this time around to get my replenishments because I look online to see what's cheapest at the time and I go for that. And I also bought this box from TK Maxx, which basically is going to fit everything in. I'm going to organize it all nicely, make sure everything fits, including all of my masks. And so it's all going to go in there. That is what I have done today, organize my drug box. Did you guys know that the last time I filmed my OTC drug haul was 4 years ago? I could not believe it when I saw YouTube. Honestly, time is just flying. I just have no idea what's going on. I'm trying to come back and do some more videos, but like 7-month-old baby, it's just a lot right now. But I really hope that you enjoyed this video and that you found it somewhat interesting and helpful. I shall see you in the next one. Bye!